Typical pneumonia versus atypical pneumonia. Typical pneumonia is named so because it follows the typical or classic expected clinical presentation of pneumonia. Atypical pneumonia was originally named because it presented differently than the typical bacterial form, often with a milder, or atypical, clinical course. Let's discuss their differences in detail. Definition. Typical pneumonia is a severe, rapid-onset bacterial infection, often caused by Streptococcus pneumoniae. Atypical pneumonia is dubbed walking pneumonia because it is caused by different, harder-to-detect pathogens. For example, Mycoplasma. Presentation. Typical pneumonia presents with sudden high fever, greater than 101 degrees Fahrenheit. Chills, productive cough, phlegm, and sharp pleuritic chest pain. Atypical pneumonia is gradual onset, with dry and unproductive cough, low-grade fever, headache, muscle pain, and fatigue. Cough of pneumonia. Its productive cough can produce thick, green, yellow, or rusty mucus sputum. Atypical infections are often characterized by a cough that lasts longer than the fever, for weeks or even months after the fever has subsided. Causes of pneumonia. Typical pneumonia is caused by Streptococcus pneumoniae, Staphylococcus aureus, and Haemophilus influenzae. Atypical pneumonia is caused by Mycoplasma pneumoniae, common in younger people, Chlamydia pneumoniae, and Legionella. WBC count. Typical cases often show marked leukocytosis. High WBC count. Atypical cases are more likely to have normal WBC counts or relative lymphopenia. Diagnosis of pneumonia. Typical pneumonia is confirmed via sputum gram stain and culture. Atypical pneumonia requires special diagnostic tests, such as PCR or serology, because they cannot be visualized with a gram stain. Appearance on chest X-ray. Typical pneumonia shows dense, homogeneous consolidation that look like white patches on X-ray. Atypical pneumonia shows diffuse, patchy, or interstitial infiltrates. Location on chest X-ray. It is confined to one lobe, lobar, or segment. It is often bilateral, both lungs, and patchy, rather than restricted to one lobe. Additional features on chest X-ray. Air bronchograms. Air-filled bronchi shown against dense lung tissue are common. Interstitial changes, streaky shadows, are common. Treatment. Typical pneumonia is typically treated with beta-lactam antibiotics. For example, amoxicillin, cephalosporins. Atypical pneumonia is typically treated with macrolides, like azithromycin, tetracyclines, like doxycycline, and respiratory fluoroquinolinase. Why is the treatment different for both? Typical pneumonia is treated with antibiotics that target bacterial cell walls, such as amoxicillin, ceftriaxone, or augmentin. Atypical pneumonia is treated with antibiotics that inhibit protein synthesis or bacterial DNA replication, such as azithromycin, doxycycline, or levofloxacin, because these bacteria lack a cell wall or are intracellular, making them resistant to penicillin-type drugs.